Hi, I'm Congresswoman Andrea Salinas from Oregon's 6th District. I just want to answer a few questions for you. First off, how did we get here? We need to renew our spending bills every year, and the fiscal year ends on September 30th. And the Republicans did not prepare for what we are calling a shutdown. And by that, I mean they did not bring Democrats into their discussions, and they just thought we were going to go along and get along. And that didn't happen. We actually said, no, guess what? That bill that you passed a few months ago, that big, ugly bill that took away health care for millions of people, we're not going to stand for it. And we're not going to let you just pass some spending package that's going to harm people and strip away their health care. They were a little surprised because the House Democrats got together with the Senate Democrats, and the Senate Democrats said, no way. You need 8 of our votes, and we're not giving them to you. And so Republicans shut down the government. They did not negotiate with Democrats. The biggest and most urgent part is the Affordable Care Act, or the ACA. And what does it do? The Affordable Care Act, some people know it as Obamacare, is a piece of health care, and it's really health insurance that was passed under President Obama that helps with those people who maybe don't get health insurance through their employer, maybe don't get it through the federal government. So it's for small business owners, people who just get it on their own. The Affordable Care Act actually provides some subsidies for what we call cost share and the premiums. So there's some premium tax credits that people get to be able to afford the health care and the health insurance. Well, those are about to expire. And when those expire, people who need that insurance, their premiums for that health insurance are going to skyrocket. About 16,000 people just in the 6th congressional district will probably start to see notifications that their premiums will increase. Some to the tune of about $1,500 increases per month. That is astronomical. So of course we were telling Republicans, lower the cost of healthcare, bring the cost down, save healthcare for Americans. And how will this impact you? Even if you don't get your care through the Affordable Care Act, this is going to impact all of us. The whole system is at risk right now. We know that there are about 4 different rural hospitals in Oregon at risk of closure. All of this has a cascading effect, and we're all impacted by it. The one provider maybe starts to think about moving. One hospital closure happens. People have to go farther for their health care. If you don't have health insurance, maybe you end up in the emergency room. It's a system that we all use. Nobody is separated because of, oh, I have this insurance. I am working my tail off for you right now. We have to get to closure here. I am doing my darndest to make sure that we reverse these harmful, terrible cuts that the Republicans have imposed on healthcare. We're trying to lower the cost and save healthcare for Americans and for Oregonians. Thank you.